Okay friends, so in this video we will going to discuss about the risk factors. Okay, again remember that two type of strain is very important for us. One is Haemophilus influenza capsulated type B, another one is non-typeable. Okay, so Haemophilus influenza type B is mostly riskier for children. Okay, because remember in the end of the previous video I have told you that 3 to 5% of the nasopharynx is colonized by Haemophilus influenza type B in children of 2 to 5 years, right? So this is a very serious condition, right? So along with people who have spleen issues, because remember spleen play a important role in immunity against any kind of encapsulated bacteria. Okay, so those people who have undergone splenectomy, that is simple removal of spleen, and also who have suffered with or who are suffering with sickle cell anemia are very susceptible to this Haemophilus influenza type B infection, and also who have functional asplenia. Okay, and also people who have malignancies, and also who have congenital deficiency of complement component. Okay, and people with acute viral infection are also at serious risk. Okay, let's say people who are infected with influenza virus mainly. Okay, and people who are influenza virus infected can develop a serious super infection by Haemophilus influenza that can even be fatal in presence of spleen also. Okay, so this is the risk factor for Haemophilus influenza type B. First one, the children. Second are people with spleen issues, that can be due to splenectomy, that can be due to functional asplenia, that can be due to sickle cell anemia, and also people with malignancies, and the people who have congenital deficiency of the complement component, and also people with acute viral infection which can facilitate super infection. Okay, and another important, now it is time to discuss about risk factor in case of non-typeable Haemophilus influenza. Okay, so this kind of infection is mostly present in children. Okay, and people with immunocompromised condition, for example people who are infected with diabetes, people who are infected with HIV, malignancies, etc. Okay, and after a viral infection, this non-typeable Haemophilus influenza can also develop a post-viral infection. Okay, and people who have serious lung condition, for example chronic obstructive pulmonary or cystic fibrosis. Okay, this chronic obstructive pulmonary disease containing or chronic obstructive pulmonary disease is a kind of situation, people who are suffering with that kind of chronic obstructive pulmonary disease can develop bronchopneumonia by Haemophilus influenza. Okay, so this is the risk factor for non-typables. For example, that means you can observe that both the cases, both in Haemophilus influenza type B and non-typable, children are infected. Okay, and people who have developed malignancies are infected or are at risk, right? And along with that, people who have spleen issues are at risk for Haemophilus influenza type B, and people who are immunocompromised, for example who have developed diabetes, who have developed HIV and malignancies, are also at risk. Okay, and in case of the Haemophilus influenza type B, people who already are infected with acute viral infection, especially influenza virus, can facilitate formation of a super infection. But in case of non-typeable strain, we have learned that after viral infection, non-typeable strain can cause post-viral pneumonia. Post-viral pneumonia. Okay, so along with people with lung condition, for example people with chronic obstructive pulmonary disease or cystic fibrosis, can facilitate the cause of bronchopneumonia. Okay, so that is why this kind of persons are at risk. Okay, so what are the risk factors for Haemophilus influenza type B? For example, children are at risk along with people who have developed any kind of spleen issues, that may be due to splenectomy, that may be due to sickle cell anemia, that may be due to functional asplenia, okay, and people who have malignancies, okay. And another important thing, that people who have congenital deficiency of complement component and people who have acute viral infection are all at risk factor for Haemophilus influenza type B. And in case of non-typables, the children are at risk, and along with that, people with immunodeficiencies condition, okay, along with that, people with immunodeficiency conditions such as who have infected with HIV, who have infected with diabetes, or who have malignancies, okay, along with people who have just recovered from viral infection can develop post viral pneumonia due to this non-typable strain, okay. And people with serious lung condition, for example, let's say chronic obstructive pulmonary disease or cystic fibrosis, okay, under such condition the people can develop bronchopneumonia due to the non-typable strain. So that are the risk factors for Haemophilus influenza, okay. So that's it for today. So in next video we will going to discuss about the symptoms of the disease that is associated with the medical complications that we have discussed in the previous one, okay. So till then friends, bye bye.